Top 10 proven ways to stop nighttime urination nocturia and sleep better. Are you tired of waking up multiple times during the night to use the bathroom? If you're struggling with frequent urination at night, also known as nocturia, you're not alone. This common issue can seriously impact your quality of sleep and overall well-being. But don't worry today, we're going to talk about the top 10 best ways to stop frequent urination at night and how you can regain control over your sleep in your life. Nocturia isn't just a minor inconvenience, it can be a sign of underlying health issues or simply a result of lifestyle habits. Regardless of the cause, these strategies are designed to tackle the root of the problem and help you find relief. Whether it's limiting your fluid intake before bed, managing underlying medical conditions, or strengthening your pelvic floor muscles, these tips can help reduce the frequency of nighttime bathroom trips and give you the restful sleep you deserve. We'll dive into how simple adjustments, like avoiding diuretics in the evening and practicing bladder training, can retrain your body and reduce the pressure on your bladder. By incorporating these methods into your daily routine, you'll be able to better manage nocturia and improve your sleep patterns. Plus, we'll explore the role of weight management and how certain medications, when prescribed by your doctor, can be the missing puzzle piece to ending those sleepless nights. Stick with us as we take you through each step, offering practical advice, scientific insights, and helpful tips that can make a world of difference. If you're ready to say goodbye to sleepless nights, make sure to watch until the end because these 10 solutions could change your life. Number 1. Limit fluid intake before bed. Limiting fluid intake before bed is one of the simplest and most effective ways to reduce frequent urination at night, also known as nocturia. When you drink too much liquid in the evening, it gives your bladder less time to process and empty the fluids before you go to sleep. This can lead to waking up in the middle of the night to use the bathroom. To manage this, it's recommended to cut back on drinking fluids at least 2 to 3 hours before bedtime. This strategy is especially helpful if you consume diuretic beverages like caffeine, alcohol, or sugary drinks. These types of beverages can increase urine production and irritate the bladder, making nocturia worse. Instead, focus on drinking water or other hydrating beverages earlier in the day and avoid large quantities in the evening. By limiting fluid intake in the evening, you're allowing your bladder to have more time to process and empty the liquid before sleep. This can help decrease the frequency of nighttime urination, allowing you to sleep more soundly through the night. However, it's important to remain hydrated throughout the day, as dehydration can also lead to other health issues. Therefore, the goal is to strike a balance and ensure you're consuming enough fluids during the day while reducing nighttime intake. Number 2. Use the bathroom before bed. One of the most effective ways to minimize nighttime urination is to make sure you empty your bladder before you go to sleep. Even if you don't feel an immediate urge to urinate, try to use the bathroom right before bedtime to ensure your bladder is as empty as possible. This practice helps reduce the volume of urine remaining in your bladder when you fall asleep, which may delay or prevent the need to wake up in the middle of the night. For many people, nighttime urination occurs because the bladder doesn't empty completely before bed, or because the body's natural circadian rhythm is disrupted. Urinating before bed ensures that the bladder is emptied completely, which helps lower the chances of needing to wake up during the night. In addition, establishing a pre-bedtime routine that includes using the bathroom can train your body to create more predictable urination habits. If you find that you still wake up frequently during the night to urinate, despite urinating right before bed, it may be an indicator of an underlying condition such as an overactive bladder or prostate issues in men. In these cases, further medical evaluation may be necessary, but developing a habit of using the bathroom right before bed can still be a helpful step in managing nocturia. Number 3. Elevate your legs during the day. For individuals who experience fluid retention, Elevating your legs during the day can be a powerful strategy to reduce nocturia. Fluid retention or edema is a common issue for those who spend long periods sitting or standing, which can cause excess fluid to accumulate in the lower legs. When you lie down to sleep, this excess fluid can enter the bloodstream and be processed by the kidneys, often resulting in increased nighttime urination. Elevating your legs during the day, you can help encourage the redistribution of the accumulated fluid back into the circulatory system. This reduces the volume of fluid that is retained in the legs and helps minimize the need for your kidneys to process it during the night. Elevating your legs for 15 to 30 minutes throughout the day can be particularly helpful for people who suffer from conditions like chronic venous insufficiency, heart disease, or obesity, all of which can lead to fluid buildup. To elevate your legs, lie down and prop your feet up on pillows or use an adjustable chair that allows for leg elevation, full of positioning your legs above the level of your heart, as this helps the fluid drain more effectively. Combining this practice with other strategies, such as reducing fluid intake before bed, can significantly alleviate nocturia and improve sleep quality. Number 4. Manage underlying medical conditions. Managing underlying medical conditions is crucial when dealing with nocturia. Several health issues can contribute to frequent nighttime urination, including diabetes, heart disease, sleep apnea, and urinary tract infections. For instance, high blood sugar levels in individuals with diabetes can cause the kidneys to produce more urine, leading to increased nighttime urination. Similarly, heart disease can lead to fluid retention, which may contribute to nocturia as the body processes excess fluid during the night. By working closely with your healthcare provider to manage these conditions, you may reduce or eliminate the root causes of nocturia. Properly managing blood sugar levels in diabetes through medication, diet, and lifestyle changes can significantly reduce nighttime urination. If you have heart disease or another circulatory issue, your doctor may recommend medications to help control fluid retention or improve circulation. Sleep apnea is another common cause of nocturia. This sleep disorder can disrupt normal breathing patterns, causing the body to release more urine during the night. Treating sleep apnea through lifestyle changes, continuous positive airway pressure CPAP therapy, or other interventions can reduce nighttime urination. In many cases, managing these underlying conditions through regular medical care and treatment will help alleviate the need for frequent nighttime trips to the bathroom, leading to improved sleep quality and overall health. Number 5. Avoid diuretics at night. Diuretics are substances that increase urine production, and consuming them close to bedtime can exacerbate nocturia. Caffeine, alcohol, and certain medications, like those prescribed for high blood pressure, are known to have diuretic effects. These substances can cause your body to produce more urine, leading to the need to urinate more frequently during the night. To reduce the frequency of nighttime urination, avoid consuming these diuretics in the evening, especially within a few hours of going to bed. Caffeine, found in coffee, tea, and some sodas, is a stimulant that not only increases urine production but can also irritate the bladder, which can worsen symptoms of nocturia. Alcohol can have a similar effect, acting as both a diuretic and an irritant to the urinary system, making it harder to sleep through the night without waking up to urinate. If you're on diuretic medications, ask your doctor about the possibility of adjusting the timing of your doses. Taking diuretics earlier in the day gives your body more time to process the fluid and reduces the chances of needing to urinate at night. In some cases, your doctor may also recommend switching to a different medication or finding alternative treatment options if nocturia becomes a persistent issue. By avoiding diuretics in the evening, you can significantly reduce the likelihood of waking up in the middle of the night to use the bathroom. Number 6. Practice bladder training. Bladder training is a technique that can help people with nocturia by increasing their bladder's capacity and retraining it to hold urine for longer periods. This method involves gradually extending the time between bathroom visits during the day to build up the bladder's ability to retain more urine before the urge to go becomes overwhelming. By implementing bladder training, you may reduce the need for nighttime trips to the bathroom. To practice bladder training, start by timing your bathroom visits during the day. For example, if you normally urinate every hour, try extending the intervals by 15 minutes each day. Over time, you can gradually increase the time between bathroom visits until you're able to hold your urine for longer periods without discomfort. This training process can help your bladder stretch and become more efficient at holding urine for longer durations, which can extend your nighttime sleep. It's important to be patient with bladder training, as it can take several weeks or even months to see noticeable improvements. Additionally, maintaining a consistent routine is key, as your bladder needs time to adjust to the new schedule. If you continue to struggle with nocturia despite bladder training, consulting a healthcare provider can help determine if there are any underlying issues contributing to the problem. Number 7. Try pelvic floor exercises Kegels. Pelvic floor exercises, also known as Kegel exercises, are designed to strengthen the muscles that control urination. These exercises can be particularly helpful for people experiencing nocturia, as they can improve bladder control and reduce the urgency to urinate. The pelvic floor muscles support the bladder and other pelvic organs, and strengthening them can enhance the ability to hold urine, both during the day and night. To perform Kegels, simply contract the muscles you would use to stop the flow of urine. Hold the contraction for about 5 seconds, then relax for 5 seconds. Repeat this cycle 10 to 15 times, aiming for 3 sets per day. Over time, consistent practice can help improve bladder control and reduce the frequency of nighttime urination. It's important to note that Kegel exercises should be done correctly to avoid unnecessary strain on other muscles. Pelvic floor exercises can benefit both men and women, particularly those with weakened pelvic floor muscles due to aging, pregnancy, childbirth, or surgery. By incorporating Kegels into your daily routine, you may notice a reduction in nocturia and an improvement in overall bladder health. Number 8. Consider a bedtime snack. For some people, a small bedtime snack can help regulate blood sugar levels and reduce the need to urinate during the night. This can be particularly beneficial for individuals with diabetes or those who experience low blood sugar overnight. When blood sugar levels drop too low during sleep, the body can react by producing more urine, leading to nighttime awakenings. A light snack that includes complex carbohydrates and protein can help stabilize blood sugar levels. Options such as whole grain crackers with cheese or a small serving of nuts can provide the body with sustained energy throughout the night. Avoid sugary or high-carb snacks, as these can cause blood sugar levels to spike and then crash, potentially increasing nighttime urination. It's important to choose a snack that's not too large, as eating too much before bed can cause indigestion or discomfort, which might interfere with sleep. Experimenting with different types of snacks can help you find what works best for your body, and consulting with a healthcare provider or dietitian can help you identify the most appropriate choices for managing nocturia. Number 9. Maintain a healthy weight. Excess weight, particularly around the abdomen, can place pressure on the bladder, leading to increased frequency of urination. This pressure can make it harder for the bladder to hold urine, causing individuals to need to urinate more often, both during the day and at night. Maintaining a healthy weight can help alleviate this pressure, potentially reducing the symptoms of nocturia. In addition to reducing bladder pressure, losing weight can improve overall health, which in turn may help manage other conditions that contribute to nocturia, such as sleep apnea, diabetes, and heart disease. Regular physical activity, a balanced diet, and portion control are all key components of a healthy weight management plan. Even small changes in weight, such as losing 5 to 10 pounds, can make a significant difference in bladder health and reduce the frequency of nighttime urination. While it can take time to lose weight, making sustainable changes to your diet and exercise routine can have a long-term positive impact on both your bladder health and overall well-being. If you're struggling with weight loss, seeking support from a healthcare provider or a nutritionist can help you develop a personalized plan to achieve your goals. Number 10. Consult a doctor about medications. If lifestyle changes and self-management strategies don't alleviate nocturia, it may be time to consult a healthcare provider about medications. There are several pharmaceutical options that can help reduce the frequency of nighttime urination, particularly for individuals with overactive bladder or other medical conditions contributing to the issue. One common class of medications used to treat nocturia is anticholinergics. These drugs work by relaxing the bladder muscles, reducing urgency and frequency of urination. Another option is desmopressin, a medication that helps reduce urine production during the night. It is especially useful for individuals with nocturnal polyuria, a condition where the body produces an abnormally large amount of urine at night. Your doctor will evaluate your symptoms and medical history to determine the most appropriate medication for your specific situation. It's important to follow your doctor's instructions carefully when taking medications, as some may have side effects or require adjustments to dosage over time. In some cases, a combination of lifestyle changes and medications may be necessary to achieve optimal results in managing nocturia. Consulting with a doctor about medications can provide relief from frequent nighttime urination and improve overall quality of life. Summary. In this video, we've covered the top 10 best ways to stop frequent urination at night nocturia. Whether it's limiting your fluid intake before bed, practicing bladder training, or managing underlying medical conditions, these tips are designed to help you reduce nighttime urination and improve your sleep quality. We've discussed how simple changes in lifestyle, such as elevating your legs during the day or avoiding diuretics in the evening, can make a significant difference. Additionally, we've explored how pelvic floor exercises, weight management, and even medications can help you gain control over your bladder and get a full night's rest. If you've been struggling with nocturia, these practical solutions offer hope and can help you reclaim your sleep and energy. Thank you so much for watching. We hope you found these tips helpful and that you can start incorporating them into your routine to tackle frequent nighttime urination. If you enjoyed the video, don't forget to give it a thumbs up and subscribe for more health and wellness content. And if you have any questions or want to share your own experiences with nocturia, feel free to leave a comment below. We'd love to hear from you. Remember, improving your sleep starts with small changes, and you're not alone in this journey. See you in the next video.